the Journal of Child Psychology and Psychiatry, celebrating 60 years of empirical research, clinical studies, and systematic reviews. For details of our 60th anniversary celebrations, visit www.acamh.org/JCPP60. Follow us on Twitter with the handle @thejcpp and use the hashtag JCPP60.
Great. Thank you, Pasco. And happy birthday to JCPP. I feel like we should all be wearing birthday hats for the television. Right. So I'd like to use my 10 minutes today to tell you some surprising findings about mental disorder from a 4-decade longitudinal study. And I'm referring to the Dunedin longitudinal cohort study that takes place in New Zealand. The study has now survived 4 editions of the DSM. Like many of our colleagues here. The psychiatric diagnostic interviews began in 1982 and are still ongoing now in the middle of 2019. So we asked 3 overarching questions of these data: who gets mental disorder, when, and do people retain the same diagnosis over decades of their lives? This shows you the design of the study. It began in 1972 as a 1-city birth cohort. On the left, you can see that the Dunedin study has assessed mental disorders on 7 occasions. At each wave, we used a past year reporting period. And on the right, you can see, especially down at the bottom, that the study has had good retention over the years, with 92% of the study members taking part so far at age 45, and we have a few more months remaining. This is a list of the 17 DSM disorders that have been assessed by interviewing each study member privately. I've organized them here in this talk by family. So we have the externalizing family, the internalizing family, and the thought disorders family. And we included OCD among the thought disorders because when we first started working on this, it was being considered by the DSM-5 working group as a thought disorder, and factor analysis has subsequently showed that it fits nicely with mania and schizophrenia. Study members have to meet the diagnostic criteria according to the DSM. We also require self-rated impairment, and we document corroboration of key symptoms by informants. Now, I'm showing you the most surprising finding first. Across 4 decades of life, the cohort members have moved in and out of internalizing, externalizing, and thought disorders. I'll walk you through this slide. Up at the top, you see a thin black line, which represents the study members who have died over the course of the study. Down at the bottom, there's in gray, it shows those who have missing data at any given period. The green shows periods when each study member was well and had no disorder. To represent disorder, the blue equals internalizing, red equals externalizing, yellow equals thought disorders, and then the blended colors represent times when people had multiple families of disorder. For example, purple shows people who had both internalizing and externalizing. Each column of this chart is one of the study waves, with age 11 on the left and age 45 on the right. So it turned out to be quite rare for an individual to keep one diagnosis, or even to keep within one of the diagnostic families. This is just a quick glimpse, and I'm going to now unpack the data, and then I'll come back to this chart later. So here you can visualize the raw data of the study. Each column is one of the 7 study waves from age 11 to age 45. Each horizontal line represents one of the 1,037 study members. Yellow shows you a time when the study member had a disorder. On the bottom left, you can see about 1/3 of the cohort had onset of diagnosis, research diagnosis by age 15. Green shows you a time when each study member is free from disorder, and if you look up at the very top right, you can see there were very few study members who were left by age 45 this year who had never had any research diagnosis. of mental disorder. The darker orange colors and brown colors show you periods when the study member had more comorbid disorders. If you look down at the bottom right, you can see that those who had onset youngest had a pattern of more comorbid disorder and more persistent disorder across time. So now I'll just delve into these data. So, how many people experienced a mental disorder in the first half of the life course in this cohort? The answer is 85% of the cohort had onset of a disorder by age 45. Now, you're probably shocked and wondering, is the Dunedin cohort study the only study to show this very high lifetime prevalence rate of disorder? So this shows you prevalence rates, lifetime, from 5 longitudinal cohort studies done in 3 countries that have carried out repeated diagnostic interviews over time and counted disorder as it accumulates. The cohorts report prevalence totaling somewhere between 65% and 85% lifetime, and that looks fairly similar to what we get in the Dunedin study. The highest lifetime prevalence rates are being reported from the studies that started the youngest and that have had more waves of assessment, which makes sense. So at what age do most people experience their first disorder? In the Dunedin cohort, about 35% of the study members had their first diagnosis by age 15, another 25% by age 18, totaling to about 60% or 2/3 who had onset as a child or adolescent. Good news for JCPP. Okay, so is early onset of disorder a harbinger of more disorder to come? This chart shows you that early onset predicts more subsequent years with disorder in a lifetime. Each column, again, is a wave of the study. The darker brown colors, I'm not getting there yet. The darker brown colors show you that more study waves with a diagnosis. If you look to the left side of this chart, you see the study members who had the earliest onset as a young person tended to have disorder at 4 years, 5, 6, or even 7 out of the subsequent study waves. This chart shows that study members with early onset also tended to experience more different types of diagnoses over their lifetime. So here, again, the darker brown color represents more diagnoses accumulated. On the left, you can see that those who had their onset as a young person tended to have 3 or 4 or 5 or even more different kinds of diagnoses over their lives, up to age 45. So does anyone retain just one exclusive diagnosis over the lifetime? Do people tend to stay with a disorder within a disorder family over their lives? This is an important pragmatic question for us because so much of our work as mental health professionals is diagnosis driven. We have specialist clinics for depression, for ADHD, for substance abuse, for psychosis, and so forth. We have treatment protocols that are tailored to a specific diagnosis. We have journals that are disorder specific. And in the United States, we even have funding agencies that are disorder specific. So this chart shows you that in the Dunedin cohort, members who ever had a disorder, fewer than 10% retained one single diagnosis type over their lifetime. On the left, if you look at the left blue column, this represents those who ever had any internalizing disorder. Down at the bottom, the very darkest blue part, are those who kept their specific internalizing diagnosis, such as major depressive disorder or panic disorder. That was only 12.7% of those with internalizing disorder. The medium blue part shows that 18% had a comorbid diagnosis, but it stayed within the internalizing family. I think this is what I expected to happen. But then the surprise is at the lightest blue part, which shows that 69% of those with an internalizing disorder also had diagnoses that went outside the internalizing family, and they developed an externalizing disorder or a thought disorder. The situation was similar for people who had an externalizing disorder. That's the red column. 75% of them also had internalizing or thought disorders over the course of the study. And then if you look at the yellow column, you see all but one individual with a thought disorder also had diagnoses in the other families as well. So do people experience different kinds of psychiatric disorders across their life course in some sort of meaningful sequence or pattern? You saw this chart before. Over the 4 decades, people have lots of different disorders, and they have them at different times, and they move between types of disorders in patterns that are nearly random. The data point to something like a hydraulic process. There's a general liability for psychopathology, and it flows through the life course like an underground river. And at different times, it comes to the surface and bubbles up, but each time it can take a different form of a disorder or syndrome over the life course. This chart shows you the same analysis, but just now for the 72 members of the Dunedin cohort who have been treated as an inpatient for a mental disorder or a substance abuse treatment at some point during the 4 decades. Only 2 of these 72 patients retained one single pure diagnosis family over the 4 decades. And this means that serious cases who are found in clinical settings are highly likely to cross disorder families when followed up later. So what did we learn from analyzing 4 decades of diagnostic data? First, we learned that mental disorder affects virtually everyone eventually, if you live long enough. Secondly, mental disorder typically onsets by adolescence, and if so, it persists decades thereafter. We learned that nobody gets just one disorder and keeps it very long. And we learned that over the decades, individuals experience many changing disorder types and shift freely between internalizing, externalizing, and thought syndromes. This kind of evidence is suggestive of the hypothesis that all psychiatric diagnoses share some common forms of etiology. I think it also suggests that when we meet a clinical patient or a research participant, we should think of this person not as a person who embodies their current presenting diagnosis, but as a person who had different disorders in the recent past before we met them, and a person who's going to have yet other different disorders if we would see them again in the near future. So that's what I know about epidemiology. Thank you.
To be part of the advancement of child and adolescent mental health, visit www.acamh.org.